VELscan is the world's #1 comprehensive oral examination recommended by WHO. During this training module, we shall cover all the crucial parts of VELscan application in our practice. VELscan is done with the VELscope Vx device. VELscope is developed by British Columbia Cancer Research Institute, which is regarded as the world's #1 cancer research institute. VELscope, it is a detection and discovery tool used for the enhanced visualization of oral mucosal abnormalities. The most important advantages include early detection, its ease of use, it is painless, and provides evidence-based care. The VELscope Vx device works on the principle of tissue fluorescence visualization. Our mucosa contains fluorophores. We use visible light which falls on the mucosa, and if it is normal due to excitation of these fluorophores, it will appear green. Abnormal areas will appear dark because there will be loss of fluorescence. To get started, it is very easy. Let us watch the video.
Make sure your patient is wearing safety glasses. This is a brand new VELscope. Now I'll be placing the well sheet and well cap on the device. Position the VELscope approximately 3 to 4 inches from the patient's mouth. Turn on by pressing this power button. What will you get to see from a VELscope? For example, healthy mucosa will appear green in color. Bacterial infection will show red in color. Fungal infection will appear yellow in color. And anything abnormal will appear black in color, suggestive of loss of fluorescence. If you see any black suspicious area under the VELscope, it requires further investigation. You have to look for 3 things. First is the border, second degree of darkness, and third is the blanching test. In case of dysplasia, you will see a well-defined border. You will find similar degree of darkness in and around the area. Dysplastic lesion will have a negative blanching test. Now it's time to document your findings. Take an iPod, attach it on the VELscope, and click a picture. In case of any abnormalities seen under the VELscope, go ahead with the world's most advanced DNA Ploidy test.
What are the applications of the VELscope Vx device? VELscan examination is done as a screening procedure for healthy as well as high-risk patients once in a year. Screening is an important process as 25% of the diagnosed cases of oral cancer do not have any associated risk factors. The VELscope Vx device allows us to see the exact extent of the lesion and hence guides us to collect the most representative sample for DNA Ploidy test and biopsy. It is used in oral cancer surgery to decide appropriate surgical margins. Research at BC states it reduces the risk of recurrence up to 90%. VELscan examination should be done post-surgically every 6 months in oral cancer patients to monitor follow-up and early detection of recurrence. When we discover oral abnormalities with VELscan, we must investigate it further. WHO recommends that all OPMD and suspicious lesions must be investigated to rule out cancer risk. We can perform the painless and non-invasive AI-powered DNA Ploidy test to rule out the risk of oral cancer. At an early stage, we may not be able to see the morphological changes or any white or red patches clinically and also any morphological changes under the microscope. But DNA Ploidy test helps us to assess these molecular changes as it targets aneuploidy, which is the most important and an early change that takes place in cancer. As an oral pathologist who often needs to collect specimens for DNA Ploidy and biopsy, I find the VELscope guidance very useful as it minimizes the chances of inaccurate sample collection. The red marking is for the biopsy sample, and we can collect from here as it clearly shows the affected area. A biopsy sample should ideally include abnormal and normal tissue as well. The VELscope Vx device makes it easy for us to identify this. VELscan supports photo documentation, which is very important in providing evidence-based care and communication with patients. We all believe what we see. So when we provide evidence-based care by showing the patient a picture, it helps us to establish trust and the patient is convinced. Also, with follow-ups, we can monitor any changes and progress of treatment and maintain a follow-up post-surgically as well. Effective patient communication is a very important part of growing practice and maintaining patient trust and satisfaction. VELscan helps us to connect with patients and explain them the risk of neglected oral care. We can say that we at our clinic practice complete oral examination protocol. We believe and we make sure that our patient is told about his or her oral health status, which includes the soft and hard tissues. Here, we have a specialized device that is used to see abnormalities of soft tissues that cannot be seen with the naked eye. It does not have any radiation and is painless. It will take less than 2 minutes. Connect with the chief complaint. Appeal to negative habits such as tobacco use. 1 extra minute that we spend educating the patient will go a very long way and is appreciated. How do we interpret what we see with the VELscope? The normal mucosa shows healthy clean fluorescence. Certain normal variations should not be misinterpreted as pathology. The linea alba and the lateral border of the tongue, which is at the line of occlusion and adjacent to the teeth respectively, both will show loss of fluorescence. A pigmented lesion or amalgam tattoo will appear as a dark area and will not blanch on diascopic pressure test. Normally, the anterior tonsillar pillar is well vascularized and hence shows loss of fluorescence. When we want to differentiate normal and abnormal, always look for bilateral presentation. A similar picture will be seen on the opposite side where it is a normal structure. Melanin pigmentation is a normal variation and it will appear as a uniform band of loss of fluorescence on the attached gingiva. Clinical correlation is an important aspect as well. Here we have a case of benign migratory glossitis and we can see dark areas of depapillation and inflammation on the dorsal surface. Fungal infection reflects as yellow fluorescence and bacterial infection as orange or red fluorescence. Both clinical pictures are not apparent under white light. With VELscan examination, we can see the loss of fluorescence clearly. On histopathology, case 1 shows increased proliferation and keratinization, whereas case 2 shows invasion of the connective tissue and increased proliferation of cells. The oral mucosa is usually non-keratinized except for the hard palate and the attached gingiva. So keratinization is an abnormal feature for the lateral border of the tongue. A clinical case of simple polyp showed an abnormal finding on VELscan examination, which was diagnosed as a one area of mild dysplasia and the other as carcinoma in situ. We have 2 cases of visible leukoplakia, one of which showed loss of fluorescence, which on biopsy was diagnosed as severe dysplasia, and the other shows normal healthy green appearance, which on biopsy was normal. Hence, VELscan examination findings are consistent with biopsy reports. For advanced training, we have a video training on YouTube, online VELscan training with tests, VELscan image library. You can access all the resources and links from the VELscan training module. How to take care of the VELscope Vx device. Always ensure that the device is placed on the charging cradle when not in use, and at all times it should be covered with a well cap to preserve its optics. The lens should be cleaned with pre-moistened lens wipes. The device can be sterilized using a clean sterile swab and sterilium before and after every patient. We have been introducing cutting edge technology in India, working with the leading institutions, scientists, and medical professionals, providing the most effective and affordable solutions for cancer prevention, early detection, and successful treatments. Thank you for your kind attention. I am Dr. Darshana.